here comes like the skin grafting, and how the skin grafting is one of the very important treatment management for patients with burn injury. Here you can see what exactly is the skin graft. A skin graft is a sheet of skin that consists of epidermis and varying amounts of dermis that is detached from its own blood supply and placed in a new area of the body. Now, this particular, because we know whenever there is a burn injury, the maximum layers which has been injured or dead are the epidermis, dermis, and some portion of the hypodermis, and some portions, if it is a deep burn, some portions of fat and subcutaneous tissues or subcutaneous muscles. Now, here if you see, related to the skin grafting procedure, a particular area of dermis and some amount of particular area of the epidermis and some amount of dermis that has been taken from a healthy skin, and then it will be replaced to the burn area. That is number one. This is about the definition of the skin graft. Now, what is the purpose? To provide a permanent skin replacement which supply, sensitized, and durable. So it will give a permanent look. It will give to the permanent replacement of the skin which has been like devastated due to the burn injury, and then it will give the blood supply, the nutritional supply, and then the durability, the longevity of the skin also will be present. Now, related to the functions of the skin graft, it is a biological cover, right? It will help in thermoregulations. That means temperature regulation can be done with that skin grafting new skin, and it will give a good identity and beauty, right? Because the cosmetic purpose also is important, because patients after the burn injury, sometimes they have a identity difficult because of the the scar formations. Like it's difficult for them to accept that is it me. So the the original look has been gone. So that will give the skin grafting also will give a good identity, and also it will give a cosmetic look to the patient. Next, coming to again another definition of the skin grafting. Skin grafting is a surgical procedure in which skin or a substitute is placed over a burn or a non-healing wound. Yes, just now I told you that a part of dermis, epidermis, and some varying amount of dermis is surgically been replaced from a healthy skin to the skin where the burn has been occurred, or maybe some non-healing wound is present. Now, purpose: permanently replace damaged or missing skin to provide temporary wound covering. Sometimes, two, three types of operative procedures also sometimes may be done, because in one procedure, one replacement, sometimes the full skin grafting procedure may not be complete. So, 2-3 settings may be required for the surgeons. Now, here you see the maximum layers which is infected is the epidermis. Then the 5% is the dermis. 95% is the dermis, 5% is epidermis, and again you see some portions are subcutaneous tissues and fats. So this is the layers of epidermis. The epidermis also can be seen in this picture with various layers. So this is the anatomical look of the skin. Next, all these things, epidermis, what is the purposes of epidermis? Epidermis provides protective barrier against mechanical damage, then microbe invasion, water loss. Okay, these are the three very important purpose of our epidermis. So basically, it will help us, or it is a protective barrier cover related to the mechanical damage. Mechanical damage, you can see any kind of shear, tear, right, lacerations. Then this is the first contact, first microbe invasion which is the first protective layer? Epidermis is the first protective layer. Any kind of microorganism which has a direct contact or which try to invade our immune system will first get in touch with the epidermis. And then again, the third function is the water loss. The epidermis used to prevent from the water loss, and that is also one of the most important function of this particular layer of the skin. Now coming to the dermis, what happens to the dermis? It gives a mechanical strength. Why? How it gives a mechanical strength? Because the dermis is having collagen and elastin in it. All right. So now, what is the purpose of this collagen and elastin? Because it gives a mechanical strength. Tear, shear, all these things will occur in the epidermis. But that epidermis, until and unless the injury or the breakdown in the skin, it doesn't reach the dermis. So this particular dermis it doesn't reach the actually subcutaneous fats. So that is the protective layer that dermis does, because there is the presence of collagen and elastin into the part of the dermis. Then the sensation, yes, temperature, pressure, proprioception, these are the particular sensitive areas of the dermis, and this particular layer helps in this type of functions. The sensation, the temperature, the pressure, then all these receptors will be present. Those neurovascular receptors are present in the dermis layer. Then third is the thermoregulation. This because of the presence of vessels, microvessels, capillaries, supplies of bloods, vessels, blood vessels, and the sweat glands. So that is what is important for the temperature regulation. So this is a rough idea about the anatomy of epidermis and dermis. Now coming to the skin grafting. Skin grafting, if you see, please mute yourself. If you see here, the classification of the skin grafting, it has been divided into 4. Autograft, isograft, allograft, and xenograft. All right. So autograft, isograft, allograft, and xenograft. Now coming to these are the terminologies. So please be attentive in the class. So autograft. What is autograft? Auto means self. Skin grafting is obtained from another part of your own body that is undamaged and healthy. So if a person is having a burn injury and from the same body, the graft area has been taken, so that is called as autograft. It can be taken from the trunk, it can be taken from the stomach, or maybe in the vastus lateralis muscles. So any of the muscles where there is healthy fat, healthy subcutaneous fats and tissues. So that muscles can be, flap can be taken, skin flap can be taken and excised out, preserved, and then it can be replaced to the unhealthy skin. This is autograft. Now allograft, it is from a donor. Skin graft is obtained from a donor which is preserved and frozen and made available for use when needed. Now allograft is usually used as a temporary skin graft. So autograft can be used as a permanent skin graft, but allograft can be used as a temporary skin graft. After that, maybe some kind of plastic surgery operations, or maybe cosmetic operation, or maybe temporary skin grafting can be done. Because as I mentioned in the beginning, in the introduction only, the stepwise, or there might be various stages of operation. Sometimes it is required. Now, what is xenograft? Skin graft which has been taken from an animal. Which animal? The pig. Are called as xenograft. Xenograft is also considered to be as a temporary skin graft. So we got autograft, allograft, and xenograft. Now again, this in classification, you got autograft, allograft, and xenograft. Now types of skin graft, this is a split thickness skin graft and full thickness skin graft. STSG and FTSG. When we talk about, full thickness skin graft, when we talk about a full thickness skin graft, it is up to the subcutaneous layers. If you see here, epidermis, dermis, and subcutaneous layers considered to be 100% of the skin layers. Now, when we talk about like if the full thickness skin graft, then up to the subcutaneous tissues and fats, the graft will be taken. Now, if it is a split thickness skin graft, the layers may be thin, medium, and thick, but up to only dermis, the layers might be taken, epidermis and dermis. Are you all understanding what I'm telling? Yes?
Yes, ma'am.
Difference between a split thickness skin graft and a full thickness skin graft?
Yes, ma'am.
So when we talk about the split thickness, remember that a part of